we have already implemented certain interventions for food handling. We've trained over 14,000 food handlers in the last 3 years to a certificate standard, really through our Public Health Inspectorate. And we've trained over 70 trainers so that our trainers can still train even more people. We've introduced identification cards so that people who are potential customers know that the person that they are buying from has been trained and knows how to handle food properly. But in terms of other interventions, for example, when you go to your physician, if the symptom, if the shitnins as you call it, or the vomitings is caused by a virus, then obviously the physician would not need to use antibiotics, which don't help against viruses, they help only for bacteria. But if it's a bacterial cause, then the physician would want to use antibiotics. But in fact, if you use antibiotics for a viral disease, you are really only encouraging resistance for the body to that antibiotic and incurring a cost unnecessarily to the health system. And the health system, of course, is paid by all of us, Jules, by your taxes, by my taxes, Patrick, by your taxes, by all of us. And it doesn't work. So what we'd like to do is to encourage both the patients and the physicians to consider taking the stool sample so that we can have a laboratory confirmed diagnosis which will make the treatment more effective and efficient, and so that we can understand within the country exactly what's causing the problems, because in the chain of events from actually growing produce in the agricultural fields to chickens to cattle to whatever, through the Belize Agricultural Health Authority role of monitoring that part of the food supply chain, through to the actual preparation and serving of food products. The interventions will be different at each stage depending on what is the causative agent for the disease.